Now coming to the external carotid artery. So external carotid artery arises from the upper border of the thyroid cartilage. Upper border of the thyroid cartilage, the common carotid artery divides into internal and external carotid artery. Here I will talk about the external carotid artery. So external carotid artery originates from the upper border of the thyroid cartilage. Then it runs upward, backward and laterally and enters behind the neck of the mandible and divides into superficial temporal artery and the maxillary artery. Superficial temporal artery and the maxillary artery. Now, the external carotid artery has the curved course. So anteromedially there lies the internal carotid artery. Anteromedially there is a internal carotid artery. Now it is in the carotid triangle. So the carotid triangle, it lies superficially. The external carotid artery lies superficially under the cover of the sternocleidomastoid, because sternocleidomastoid totally covers this external carotid artery, the carotid triangle. So under the cover of the sternocleidomastoid. Now superficially there is a cervical branch of the facial nerve. So there is a cervical branch of the facial nerve. There is glossopharyngeal nerve. There is hypoglossal nerve. There is a superior thyroid vein, lingual veins, facial veins. All are superficial to the external carotid artery under the cover of the sternocleidomastoid muscle. Upper part of the sternocleidomastoid muscle. Now deep to the artery, there is a pharynx, wall of the pharynx, the superior laryngeal nerve, which divides into two parts, the external and internal laryngeal nerve. So these are under the under the carotid artery, external carotid artery, within the carotid triangle. Now above the carotid triangle, the external carotid artery enters into the deep substance of the parotid gland, and within the parotid gland it divides into two, that is the superficial temporal artery and the maxillary artery. Superficially there is a retromandibular vein and the facial vein, facial nerve. These are all superficially. Now deep to the external carotid artery there is internal carotid artery which lies anteromedially, and between the external and the internal carotid artery some structure passes like the styloglossus, the pharyngeal branch of the 10th cranial nerve, that is vagus nerve, 9th cranial nerve, stylopharyngeus muscle, styloglossus muscle, all are lie between the external and internal carotid artery. Okay, now the branches of the external carotid artery. So external carotid artery has anterior division, posterior division, medial and terminal. So terminal is the maxillary artery and the superficial temporal artery. Now medially one artery is there, that is the ascending pharyngeal artery. Pharyngeal artery. Posteriorly there are two arteries. One is occipital artery. Occipital artery. Another is posterior auricular artery. Anteriorly there is superior thyroid artery, which is the first branch of the external carotid artery. Superior thyroid artery. Second is lingual artery, and third is facial artery. Facial artery. So these are the anterior division. Now coming to the superior thyroid artery. The superior thyroid artery arises from the external carotid artery, anterior division. Now it runs downward below the greater horn of the greater cornu, or the greater horn of the hyoid bone. This is the hyoid bone. Now it runs downward, forward, parallel to the external laryngeal nerve. Parallel to the external laryngeal nerve, it entered to the, it is deep to the infrahyoid muscles. It is deep to the infrahyoid because there are some infrahyoid muscles, the sternothyroid, the sternohyoid, all the infrahyoid muscle below the straps of the infrahyoid muscle. These arteries is present along with the external laryngeal nerve. Enter to the upper pole of the thyroid, the upper lobe, the apex of the thyroid, and gives a branch to the laryngeal artery. Along with the external laryngeal nerve, it enters into the thyroid membrane. It pierces the thyroid membrane and supplies the supply to the larynx. Another branch is the thyroid branch, which gives the blood supply to the thyroid, and it anastomosis with the inferior thyroid artery. Another branch is the muscular branch, which gives the blood supply to the sternocleidomastoid and the cricothyroid muscle. This is all about the superior thyroid artery. Now coming to the